Snoring is a raspy noise produced in the nose and throat during sleep, caused by the fluttering of soft tissues like the soft palate. While it is quite common and becomes more frequent as people age, it results from the relaxation of muscles that narrows the upper airway, making tissue flutter like a flag in a breeze. Snoring can have significant social consequences, often causing stress between bed partners or roommates. Beyond the noise, other symptoms may be present, such as waking up frequently, gasping or choking during sleep, excessive daytime sleepiness, and morning headaches. Snorers are often unaware of their own noise unless told by others. It is critical to distinguish between primary snoring and sleep-disordered breathing. Primary snoring does not cause frequent waking, and airflow and oxygen levels remain normal. However, sleep-disordered breathing, like obstructive sleep apnea or OSA, involves the airway becoming blocked, leading to disturbances in sleep and airflow that require medical attention. In cases of obstructive sleep apnea, individuals experience 5 or more episodes per hour where breathing stops or becomes very shallow. This condition is serious because it significantly increases the risk of developing high blood pressure, stroke, heart disorders, and diabetes. Identifying OSA is the main goal of medical evaluations for snorers. Several risk factors contribute to snoring and sleep apnea. These include being over the age of 50, obesity, particularly fat distributed around the midriff, and the use of alcohol or sedatives before bed. Chronic nasal congestion and smoking also play a role, and the condition frequently occurs in families, suggesting a genetic component. Physical traits also increase risk, such as having a small jaw, large tonsils, an enlarged tongue, or a deviated nasal septum. Doctors specifically look at neck circumference, as OSA is more likely when the neck is larger than 16 inches for women and 17 inches for men. These anatomical factors physically narrow the breathing passage. You should seek medical evaluation if warning signs are present. These include witnessed episodes of not breathing, choking during sleep, or very loud, constant snoring. Other red flags include waking up with a headache, feeling excessively sleepy during the day, or having high blood pressure, which may all suggest the presence of sleep apnea. During a physical exam, a doctor will calculate your body mass index and inspect the nose and throat for obstructions like polyps or an enlarged uvula. They will also interview bed partners to understand the severity of the snoring, such as whether it occurs every night and if there are visible interruptions in breathing. To confirm a diagnosis of OSA, doctors often recommend polysomnography. This is a sleep study where you stay overnight in a laboratory while your breathing, oxygen levels, and other functions are monitored. While costly, it is the gold standard for identifying sleep-disordered breathing, though home sleep studies are sometimes an option for some patients. Treatment often begins with lifestyle changes. These include sleeping with the head elevated, using blocks or a wedge pillow, and practicing side sleeping. A common trick is attaching a tennis ball to the back of a nightshirt to prevent rolling onto the back. Weight loss and avoiding alcohol for several hours before bedtime are also highly effective. Oral appliances, fitted by specialized dentists, can help keep the airway open during sleep. Mandibular advancement splints are plastic devices that pull the lower jaw and tongue forward. Alternatively, tongue-retaining devices use suction to keep the tongue from falling back. While they can cause some tooth movement or salivation, most people tolerate them well. For those with OSA, continuous positive airway pressure, or CPAP, is the most effective treatment. Patients wear a mask over the nose or mouth that delivers pressurized air to prevent the airway from collapsing. While it requires a period of adjustment, most patients find it provides significant relief from symptoms and reduces long-term health risks. Surgical options exist to treat airway obstructions or reshape throat tissues. Procedures like uvulopalato-pharyngoplasty remove excess tissue to widen the airway, while laser-assisted uvuloplasty uses a laser to reshape the area. Other methods, like injection snoreplasty or radiofrequency ablation, aim to stiffen the soft palate to reduce vibration, though long-term effectiveness is still being studied. Newer technologies offer alternative treatments, such as a removable tongue muscle stimulator. This device is worn during the day and uses electrodes to stimulate the nerves and muscles in the tongue, helping them function better during sleep. While promising for improving muscle tone and reducing snoring, more studies are needed to determine its long-term success. In summary, while snoring is common, it can signal serious health issues like obstructive sleep apnea. By identifying warning signs, undergoing proper medical evaluation, and utilizing treatments ranging from lifestyle changes to medical devices or surgery, individuals can improve their sleep quality and reduce the risk of associated conditions like heart disease and stroke.